Kind of walk me through how, a patient might, move through a new patient might move through the workflow and how something, that may traditionally, look like, okay, this is going to be, a patient with a lot more touch points. It's going to be much more clinically demanding patient. How do you integrate that in and make it all work?
Yeah, so actually that comes from, and I'll tell you right now, I'm the biggest Pioneer fangirl you're ever going to meet. That comes from our lovely Pioneer system. And I will tell you, not to call myself a super user, but but I use Pioneer at a pretty high clip to do a lot of
Yeah.
automation in the pharmacy. So if a patient comes in, like let's say for example, they're living with HIV, they've just come down from seeing our providers and a prescription arrives. One of the first things that we do is we start with some intake information. I'm a huge data miner, so I like to get a lot of information about the patient, their race, their ethnicities, their backgrounds, and things like that. So that way we know how we could help and reach out to patients in a much better and more efficient way. Data really can drive pharmacy in a huge way. So I can't stress enough. I know a lot of pharmacies don't like dive into like demographic and things like that. It's super helpful because it lets you know how to target your marketing and it lets you know maybe who you are and aren't reaching. You don't know what you don't know. Um, anyway, we have a patient that'll come and present at the counter. We do our intake form. We get their data entry process started. Um, from there, if the medication is categorized, I love me some auto categories. If the nation, if the patient is categorized as one of our patients from our providers, and the medication is categorized as a specialty patient, care goals start to trigger automatically.
Gotcha.
And we're an accredited specialty pharmacy, both through ACHC and DURAC. And so we have to maintain level and points of contact with these patients and levels of care with them, including an initial assessment to make sure that they're going to do well on their medication and maybe they're going to stay adherent or like identify some tools and things that we could use to help them with, as well as doing monthly follow-ups and making sure that, when we're filling this medication that we're still on goal for becoming undetectable, which is always the goal for HIV care, right? And when we do all of this, Pioneer triggers these things automatically. So throughout workflow, we will have things that'll pop up and say, okay, this patient needs to get an initial assessment, which will then let the pharmacist know once we get to the point of sale, we've got a full block. At that point, we'll take the patient into the counseling room. The pharmacist will sit down and do an initial assessment. And again, talking about that pharmacist maybe being able to do that 30-minute counseling with somebody. I've got two more pharmacists ready in the background, right? They're still in the
Yeah.
workflow. This is a really unique model. So being able to have that pharmacist be able to privately meet with that patient and assess what their health goal looks like and what do you want big picture and what can we help you do to meet goals? How can we help you? Are you struggling financially? Is there ways that we can find other things for you to help with the costs of your other medications, right? And those are the types of things that we sit down and do. And what will happen then is once we close those care goals out, depending upon the status that we use, it'll trigger again the next time that they fill. And so we get these wonderful triggered cascading reassessments and initial assessments when a new drug is or a new therapy is started. It is absolutely fantastic. So again, fanning out for Pioneer. Pioneer
Yeah.
really does
So
make my workflow go very, very well and very efficiently. And it keeps it so that way I have a great record for my patients. And when a patient comes in and talks to us, it's not like we don't remember who they are. I can pull all of it back up. And oh my gosh, I remember when you talked to me about this, you were going from first shift to third shift. And so that makes sense that you're not remembering to take your medications. Let's start a care goal. We'll follow up with you weekly. And that pops up in the trigger and the cues automatically based off of settings. And we can just follow up with patients and help them live their best lives and get their best possible outcomes.